Hi, good morning. Welcome to today's segment of the Health Corner on the Breakfast Show on Camnet TV. I am Dr. Nakuya Namfaya. This week we have been discussing about cholera, and today we are going to discuss how cholera is treated. Yesterday we talked about some of the signs and symptoms of cholera and how you can know that you have cholera. So we say that cholera can have no symptoms at all, and in some cases can have very severe symptoms. So some of the symptoms would include diarrhea, and if in severe cases the diarrhea would be so severe that it can cause dehydration. So today we are going to discuss how cholera is treated. It's important to know that cholera is curable and it is a treatable disease. So because cholera can cause severe dehydration, patients who have cholera will need to be rehydrated. In some mild cases, people who have cholera will only need to be rehydrated with ORS, which is oral rehydration solution, and most of the times they will recover after being given the solution. But in severe cases, people will need to get medical attention and be given fluids at the hospital, and these fluids will help to rehydrate them and to prevent them from having shock and having organ damage. So it's important to also know that while you are going to seek medical attention, you can start giving the patient some oral rehydration solution at home to prevent them from being so dehydrated, even as you are transporting them to the hospital. So for children who are still breastfeeding, it's important that you continue to breastfeed the children and also rehydrate them with some oral rehydration solution. So the other thing that at the hospital that they usually do for patients with cholera is that they treat them with antibiotics. Antibiotics help to treat the infection and also to prevent or to reduce the shedding of the bacteria through the feces, to reduce the contamination of other foods and for other people to not to get the disease from those that have been infected. So it's important that you go to the hospital to get proper treatment and to get proper attention from your medical doctors. So this has been the segment for today, and today we have learned that cholera is treatable and that cholera can be treated with fluids, and these are oral rehydration solution and IV fluids at the hospital. So be sure to take your children and your loved ones that are ill or sick to the hospital once you discover that they have cholera. So continue to watch Camnet TV and continue to tune into the breakfast show in the upcoming days, as we will be talking further about cholera and how you can prevent yourself from getting cholera. Thank you so much for watching.